Hello, hello, and welcome back to the Heal with Grace podcast. Today, we are going to talk about something that I get asked all the time. Is this nervous system response? Is that nervous system response? Is actually sometimes I don't really get asked about long COVID or CFS or POTS, but it is often something that I come across. So, we're going to demystify these conditions that really have left many of you pretty hopeless. Things like chronic fatigue, long COVID, mold illness, Lyme disease, POTS, by looking at what the science shows that the root of these conditions is not a virus, it's not a toxin or a pathogen alone, but a nervous system stuck in survival. So, what you'll recognize is that, yes, there are actual physical manifestations happening in the body. There might be a virus, a toxin, a pathogen that continues to stay within the body, but it doesn't mean we need to have a reaction towards those. Our bodies are not perfect and are always going to have something wrong with it, if you will. I don't even really want to use that term, to be honest. We're abnormal human beings. Like, we're not perfect. So, this is going to be a really important one. I'm going to try to blend in some of the research and science behind this and some recovery stories as well. But also stay tuned because I'm going to have some people on the podcast that can share their story around healing these types of conditions through nervous system and mind body work. So, let's get into it. Okay. Let's start with one of the most misunderstood that seems to weave its way into literally everything, which is chronic fatigue. CFS or ME, which there's a very wide spectrum of this. So I myself have dealt with CFS on and off for a long time. I mean, I could really track it back to probably teenage years. But at the same time, well, not at the same time, but I did not deal with it in terms of being bedridden and stuck and not being able to get out of bed and work. I was almost there at one point. I was about to quit and just say, like, I can't work anymore. That was like the tipping point for me. But I just want to honor that everyone's experience is a little bit different. And what I mean by this weaves itself into so many different ways in people's lives is that sometimes it's an additional diagnosis. Like, you also have CFS along with listing out all different things, whether that's pain, whether that's long COVID, whatever it is, gut issues, mold, histamine. Usually CFS kind of goes along with this. And then also for many people, this is their primary concern where maybe it hit them right off the bat, or maybe it kind of slowly started to come into their life and eventually they had to stop life and could barely function. So I just want to recognize all the different types of people and how this shows up in everyone's life. So there's been so many people that have been very dismissed with chronic fatigue. We're told that it's just psychosomatic. There's not really much you can do. You just have to manage it, or maybe that's purely biological. And that's all completely wrong. CFS or ME is not just in your head, but it is in your brain and body's threat system. So fatigue is not evidence of broken cells. It's a protective warning signal created by a hypervigilant brain that believes you're unsafe or depleted. In neuroscience terms, the brain is constantly predicting danger and adjusting your physiology accordingly. Sorry, that was a mouthful. So basically, what I talk a lot about on here is exactly what I'm going to say now. That really, when it perceives chronic threat, when your nervous system and your brain perceives a chronic threat, physical, emotional, psychological, environmental, it may predict that resting and shutting down is the safest thing to do, right? If your body or nervous system is like overextended, it doesn't know what to do, and there's constant threat over and over, even if that threat doesn't seem very logical, it can completely shut you down. And what we've noticed, many different types of recovery stories of people who are in their life, they've been people who are high achievers or athletes, or not just any kind of athlete, but Olympians or professional athletes. Or I heard a story about a Navy SEAL the other day, like all these people that are doing incredible things in the world, and chronic fatigue completely shuts them down. And it is not about like you just need more sleep, or you're not doing enough, or you're kind of this lazy person. No, it is not that absolutely at all. It can feel like that to the person. They can be like, "Oh my gosh, what? Am I just not able to handle life like everyone?" And some people in their life might think of them as just kind of like lazy, but it's not like that at all. So you can also see this as described as an injured mammal response where your system goes into freeze or shutdown, the same instinct an animal has when it retreats to a cave to recover. So we've seen this. You can actually Google this or you can look this up on YouTube. What's the title called? I'll link it in the show notes of a mammal going through the stress response. Like they are in danger. I think it's a deer or something like that, where they are in the wild and a tiger is about to come and has pretty much caught the mammal, the deer, and about to eat him, about to kill it. And so it plays dead, just goes into a freeze, shutdown response until something scares off the lion or the tiger. They end up going away. I don't remember exactly what, it doesn't matter, but they go away and the deer still stays there, shut down, frozen, protect itself. And then you start to see it shake, like vibrating, shaking, as it's literally shaking off that threat response, shaking off the terror that it was just in the near death experience. And so as it shakes it through its body, that's how the nervous system starts to shake off or move through that threat response. But if we don't have that type of recovery or repair from things in life, this could be anything from over time, your nervous system deemed a certain person as a threat response, or a certain experience or work or emotions as a threat. And if we don't know how to process the threat and repair it, then our nervous systems go into freeze or shutdown, which is what happens in chronic fatigue. In this state in CFS, the brain never gets the update that you're safe now. That freeze becomes learned, repeated, and reinforced, which is a neuroplastic loop. So you can do all the things: rest, supplement, eat clean, get IV treatments, go through detox protocols. But until the brain's prediction of danger changes, fatigue will keep showing up. And to be honest, this is one that I myself, and I notice a lot of people that I work with have a not hard, but this sometimes is the thing that kind of lingers and lasts a while. It doesn't have to. There's plenty of people who doesn't have to, but it's hard to be in a freeze and shutdown response, that fatigue response where literally your body is aching on such a level. It's this deep, bone deep fatigue. Like if you haven't been through it, you just can't understand it. It's not just like, oh, I'm tired, I'm overtired and I need to sleep more. No, you can sleep all you want and then you literally could barely get out of bed or maybe not get out of bed because your body is just done. It feels like it just cannot move. So it's just a deep response. It's a deep response, right? So healing really comes from rewiring the nervous system to feel safe again, being alive again. And it might sound kind of silly, like I thought I was safe. Like again, these people living these amazing lives. But we have to dig a little bit deeper to understand, okay, there obviously was threat building up underneath the surface of in that nervous system, or else they wouldn't be in this place. So it's not that you're just weak or sick or whatever, or just, your body can't handle life. No, we can teach it basically to handle life. We can teach it to feel safe and be in your life and experience things and get back into the life that you love. So it's really through emotional honesty, curiosity, and really learning to respond to sensations without fear that the brain learns, well, it's okay to move. It's okay to have energy again. This is also pretty similar to long COVID, but I want to really address that when the threat response never turns off after an infection like COVID, this can lead into what we know now as long COVID. So many people, if you've experienced this or you know people that have experienced this, many people are told that they still have viral fragments, microclots, or spike proteins causing inflammation, which is why they're experiencing all these different symptoms associated with long COVID. But here's what's fascinating is that research shows that the viral load in a person's body doesn't always explain chronic symptoms. So for example, before we had COVID and before we had something called long COVID, we've had something called EBV, Epstein-Barr virus. A 2017 Journal of Virology study found that people with asymptomatic Epstein-Barr virus infections had the same viral load as those who got sick with Epstein-Barr virus. 95% of adults carry EBV and are totally fine. This is a part of my story too. I had a crash. Oh, I don't remember when this was, but it was after traveling essentially. And I was just sick and could not get over it. I swore, I was like, oh my God, it's COVID, it's long COVID. And I got tested a million times and it wasn't COVID. And then finally I got tested for EBV and they're like, oh yeah, you have EBV. It's probably just a flare in this. And nothing I did worked. Nothing. I did all the things, but it didn't work. So I guess what I'm saying here, it's really not the virus itself. It's the exactly what I just explained with CFS, it's that same response. You do not have to have symptoms if you have a underlying viral load in your body. Again, our bodies are so wise and wonderful and self-healing, and they're always fighting off something. Like, we can't be perfect. There's toxins everywhere. That's just normal. And our bodies are supposed to, literally meant to, move through that and fight them off. But over time, when threats come in time and time again, there's usually something that kind of like breaks the camel's back. And for some people, it's COVID. That's just the thing that kind of like their bodies go, okay, no more. I'm done. Your nervous system's like, no more. We're shutting down. Everything's way too dangerous out there. So, if the nervous system keeps sending danger signals through fear, stress, or unresolved trauma, those same cellular defense programs stay switched on. It's like your brain goes, oh, we have this virus in us. Yeah, okay, that's the reason we're going to keep reacting because we have this in us. So your cells are literally just trying to protect you, but they can't repair and grow at the same time. So there's something called the cell danger response that comes into play here that some people talk about in the recovery world, where Dr. Robert Navajo, and I apologize for saying that if I did not say that last name correctly. He discovered that after an infection, cells shift into a defense mode, which then they shut down normal metabolism to protect the body from harm. It's actually brilliant biology until it doesn't turn off. So some people say that this is the reason why they're in the stuck response and they need to get their bodies out of that cell danger response, which is true. It's true. It doesn't mean, though, that you only need to go through some physical protocol in order to get to that. We really need to work with the nervous system and the stress response. When I was at the ATNS, the Association for the Treatment of Neuroplastic Symptoms conference a couple weeks ago, I went to a talk on CFS and a talk on POTS. And I'm going to talk about POTS in a minute. But Dr. Thomas Kaminsky, who is a fascinating doctor who literally works with POTS, and this is almost pretty much his career now, does a lot of research around POTS. He was speaking and showed that after infections like COVID, trauma, or even bullying, the body often fails to restore vagal dominance, meaning the parasympathetic safety branch of your nervous system doesn't come back online after a threat, after a trauma. So the constant sympathetic activation drives everything from fatigue and pain to brain fog and heart palpitations. So long COVID is not a virus that won't go away. It's a nervous system that hasn't yet felt safe enough to stand down, and it's grabbing onto something to explain why it needs to shut down. That's essentially what's happening. Okay, let's talk mold. So I first want to come at this one from a place of so much compassion. It has been a very large part of my story and my symptoms up until, well, I mean, like throughout, but even last year, 2024, I still got caught in the loop of mold. Yeah, it's been a crazy one. And I also want to say, like, mold is a hard one because, I mean, I guess you could kind of say this about the other ones too, but one of my friends, Sean, who will be on this podcast that you're going to listen to, I was on the Mind Body Medicine for Chronic Pain podcast, and I was telling my mold story, and he was like, oh my gosh, it sounds like the best lie is one that has an ounce of truth to it. And that resonated so much because that's kind of what mold is. Like black mold you could see that is tearing up your home is 100% dangerous in high concentrations. That is the ounce of truth. That is very true. And I don't ever want to dismiss that. I don't ever want to say, oh, you don't have to ever react towards mold. You just think, your way and retrain your brain and you're fine. So I just have to say that. That's true. That's real. And that's why I think it gets so many of us, myself included, so tripped up about it. But let's talk about it in terms of a nervous system response, because this topic has gained so much traction in the functional wellness space that people are literally afraid of their homes, their food, even their own bodies. And here's really the lie is that mold is always dangerous. The lie is that mold is everywhere in your air, food, inside your gut microbiome, and you have to get rid of it to not experience symptoms. So, what happens is the problem over time, especially if it's not directly black mold, and there's mold, again, there's mold everywhere. I guarantee you, if we all tested our bodies for mold, which I've done many times, I always show not lots, but well, sometimes there are lots of mold in my body. The thing is that I probably have had that since I was a kid. I mean, I remember my mom saying, like, yeah, we had that house that was actually pretty moldy. So it's probably, part of where that came from. But also, y'all, it's in our food, it's in the air, it's in the dust. Like, I don't want to scare you, but it's everywhere. But our bodies don't need to react. Our bodies filter through that and fights against it, not in a harmful way, but in a way that our bodies are supposed to. But when our nervous system becomes stressed out, the nervous system interprets mold as danger everywhere. Also, you might start to learn more about mold, read all the things, watch the videos, listen to your doctor, and then you start to get really fearful about it. Oh my gosh, I did this like when I moved out of my apartment because I found mold in it. It was at first like, oh my gosh, I found the answer. This is why I'm crashing all the time and everything I'm doing, all mind body work isn't working. That was me. I thought I was doing everything I could do. So I was like, well, it has to be physical, has to be something going on. And so I tested my apartment and first did not find anything actually. The first tested it. And that could be a whole other episode where certain tests find some mold, some tests are a lot of false negatives. Like, oh my gosh, it's a whole world. But I tested again and they found certain traces of mold, which again are probably in many places. But I grabbed onto that and was like, yeah, that's what I'm experiencing. I'm moving out right away. And then I became afraid of literally everywhere I went. I was afraid of every Airbnb I went into. I wasn't sleeping. I was crashing all the time. Like I felt like absolute shit. And I really thought it was mold only. Come to find out later, it was not. I still treated myself. I do think I had an overload of toxins in my body. But again, that wasn't the only reason. Back up years prior, the first round of functional testing and everything that I went through found mold in my body, high levels of mold. So I start going through detoxing and doing all the things. I tested again and the mold had gone down in my body, but I still had zero improvement in symptoms. Then I found mind body work and started treating my nervous system and my brain. And I started to feel so much better. I tested mold again, same amount of mold was in my body, but I wasn't reacting. Same with EBV, same with long COVID spike proteins. You can have these in your body, but not react. It's just that once you've had this scary experience with mold or illness, the brain links any sign of mold, even the smell or the idea that it's there, with danger. And then it sends danger to your brain. Your brain goes, oh no, I'm going to send you all these signals, these symptoms. And so that association gets reinforced every time you react with fear, vigilance, or avoidance. So your limbic system fires up, your immune system follows suit, and you start reacting not just to the environment, but to your own fear. The truth is, most types of mold that show up in everyday environments or food are not inherently dangerous. But when the brain deems them a threat, when you learn about it, the body responds as if they are, releasing stress hormones, histamines, and inflammation. So again, your body is going through a real response. It's just that the fix is not going to be detoxing the mold. And this is how fear itself becomes the toxin. Fear is a incredible toxin in our bodies. It wreaks havoc all over our mind, body, emotions, everywhere. Now, I don't want you to become afraid of the fear either. So I want to say that with some compassion, but healing from mold sensitivity often involves retraining the brain, teaching it to separate real danger from conditioned danger. Because if your body's alarm system is blaring at every dust particle, you'll stay trapped in a cycle of stress chemistry no detox can fix. I really want you to hear that. If you are high alert and fear, and your body's alarm system is going off all the time, you can do all the protocols, everything that you can put your hands on, but it will not work if your nervous system is in the danger response. So, again, I value all types of health and wellness. So, first, that's why I think it's really important to start and work with nervous system response and then go and do something you need to do from a functional level. I professionally have worked with multiple functional practitioners where we share clients where they've been really stuck with them and nothing's working and they can't make any progress. And then they send them to me and we work on nervous system and brain retraining. And their threat response goes down, their danger response goes down. They have more confidence and they have more safety in their body so that then if they do need some kind of physical intervention, they go do that. And it actually works and helps them. And we can heal on so many different levels of the body. So I think it's a beautiful combination. It's just that the physical is not the answer. Yeah. All right. If you have any questions about mold, come and ask me. I'm a wealth of information for that. Yeah. But basically, just remember that your body does not need to be responding to low levels of mold. All right. Let's talk about Lyme disease. So, if you have noticed, if you've been in the chronic illness world, if you're in the functional medicine world, if you are in any kind of medical world, you might notice trends. So, for a long time, Lyme disease was a thing that people are getting diagnosed with and still are. CFS is always kind of mixed in there. Now it's more long COVID, but still Lyme too. It's a big one where people might be sick for years and years and years and then finally test for Lyme and they might be positive for Lyme and they're like, "Oh my gosh, this is the answer. Okay, cool. I'm going to do all the things." Because the traditional narrative is that the bacteria of Lyme hides deep in your tissues and causes chronic infection. That's the answer that you might receive. But most research now shows that after appropriate antibiotic treatment, lingering symptoms aren't caused by active infection. They're caused by nervous system hypersensitivity and immune dysregulation. So basically, your body keeps fighting something that's no longer there. Are you seeing a theme here? There might be an initial infection. There might be an initial bacteria that gets into your body or initial mold exposure, but your body goes through a treatment response, whether it's on its own or you might treat it with something, treat the infection, treat the disease, treat the bacteria, and that should be it. But if your body doesn't allow for that threat response to decrease, it's still going to respond as if there's something to fight. So this is that same chronic fight or flight loop. Again, that we're seeing in CFS, fibromyalgia, post-viral fatigue, that your immune system gets stuck on attack mode while your vagus nerve, the part that signals rest and repair, goes offline. So healing Lyme isn't about killing what's left. It's about changing your inner chemistry, moving from cortisol and adrenaline to IgA and oxytocin, from fear to safety. If you're listening to this or you know someone who has successfully treated Lyme from a purely physical standpoint, I'm actually curious to know. I haven't heard many of those stories, so let me know. But basically, no matter what protocols you follow, your immune system can't regulate if your brain is still convinced you're in danger. Yeah? All right. Now, let's talk about POTS, the body's alarm system on overdrive. This is a really interesting one. Again, I've had some experience with this myself, but then lots of other clients that I've seen experience this. When I say on a spectrum, like probably a lot more than I ever did as well. I also heard a talk about this at the ATNS conference, like I had mentioned, by Dr. Thomas Kleminski. He researches and reframes POTS as a functional disorder of the brain's survival circuits, not a structural issue of the heart. So, Dr. Kleminski talks about how he found that the periaqueductal gray, the PAG area, the midbrain region responsible for orchestrating fight, flight, freeze, or even bladder and pain modulation, becomes overactive after trauma, infection, or psychological stress. So, POTS, by the way, if you have not heard of this, it's postural orthostatic tachycardia syndrome. And it's honestly exploded in awareness, especially after COVID. Most people are told it's purely cardiovascular, drink more salt water, wear compression socks, do more cardio. And while those might help the symptoms, they don't actually treat the root cause. So instead of regulating normally, your survival brain is constantly pressing the gas pedal, increasing heart rate, tension, alertness, even when you're safe. You might experience dizziness. This is where you might stand up and pass out. Your body can't regulate your blood pressure very well. This also explains why POTS often overlaps with conditions like chronic pain, IBS, migraines, all rooted in the same threat circuitry. Dr. Kaminsky's new approach, POTS reprocessing therapy, actually focuses on retraining the brain body connection through safety, reassurance, and exposure. And he's seeing a lot of progress with it. Essentially, they're turning off the alarm system and not just making the noise. POTS is not actually the root cause is not that your heart is malfunctioning, it's your body protecting you too well for too long. Again, there's a threat response, and your body goes, no more. We are literally going to shut you down. We're going to make you pass out. We're going to make you not be in reality. So, this does take a little bit of a different approach and really recognizing how dysregulating this is for someone really struggling with POTS because it's hard to literally ground yourself, ground into reality. You might not feel like you can grasp onto reality, and just doing a simple somatic tracking, like track the pain or symptom in your body, may not fully be able to work because it's everywhere, right? Dr. Unit Arthur, the study coach, talks about this as well. And I heard her speak about this, where we do have to take a little bit of a different approach and truly meet that person where they are and recognize that they're sometimes they're truly not in the reality because they are hyper, like super dizzy. They can't even feel maybe their feet on the ground. They're literally afraid to stand up because they don't want to pass out. And so what I'm saying here and the research that supports this is that this is a true neuroplastic response. I really want you to hear me on that. If you have experienced POTS, you do have POTS, it is your brain response. It is your nervous system response. This is not something you just have to live with forever. Really, really don't have to. You can truly rewire this. And there's plenty and plenty of people that have out there. Just find the POTS stories. Yeah. Okay. So overall, if you can tell, your brain sets the tone for your physiology. Your emotions set the tone for your chemistry, and your nervous system determines whether your body is in protection or repair. I want to share a little bit about Dr. Dispenza's research, Dr. Joe Dispenza. He showed that emotional coherence, states like gratitude and love, can increase IgA, which is immunoglobulin A, which is your body's first line of defense, coating mucosal surfaces and strengthening immunity. Basically, if you can increase IgA, you can increase defense and immune responses. And we do that, he does that in his research through having people be in their heart centered space of love and safety and gratitude. And this is the emotional work that I talk about a lot on here, but I really want you to grasp how our state of being changes our physical response. So if you're sitting here in threat response thinking everything is bad, everything is horrible, why am I sick? Why am I feeling this way? Criticizing yourself, judging yourself, thinking negatively all the time, your body's literally going to go into a physical threat response. Unresolved emotional issues like shame, grief, and fear keep that brain predicting danger. And that's what creates chronic activation in the amygdala, the PAG we talked about, the autonomic nervous system, your IgA levels. It's all what keeps the cell danger response alive, the danger in your body. So, no matter how many physical interventions you try, if the brain and the body don't believe you're safe, healing can't happen. Safety is not just an idea, it's a physiological experience. Safety is a felt sense and a knowing in your brain and in your body and in your nervous system. And it completely can be learned and practiced. I still practice it all the time, because I'll never be perfect at it. I'm not walking around here being like, I'm safe all the time. I'm great. I can handle anything. I have grown in that so much, but it's still a work in progress. And with our emotions, when you start meeting your emotions with compassion, releasing control, allowing joy again, your biology follows, your physical body follows. And don't just take it from me. Listen to the stories on this podcast. Listen to the stories on other people's podcasts, Curable like Mind Body, Raylan Eagle's podcast and YouTube channel. I mean, there's a lot out there now, which is wonderful. So we have so much evidence that this is possible because your body is so resilient and it's not just broken. It's truly brilliant. I see it time and time again with everyone that I work with. It's really cool. Like, it's really cool to see people coming in. Well, it's not cool to see them coming in desperate and hopeless. That's not cool. It's cool to see that when they come in that state, but then they start to do this work, things start to shift. And it's like, I mean, I was about to say it's like magic. It's not. It's science. It's real work. Like, they're doing it. Yeah. It's just really cool to see how we can change our body's physical response by working with the brain, the nervous system, and our emotions. So this is the work, obviously, that I love to do. And if you experience anything that we've talked about today or other types of pain and symptoms and you want support, I would love to support you. I have 1 to 2 spots left for my individual clients. And then I would love to come see you and the Mind Body Healing Method, which is my group program that helps you understand how to rewire the brain, how to regulate the nervous system, and really how to come back home to yourself, feel safety in your body so that you can just live your life and you don't have to think about this all the time. You don't have to think about your body and your symptoms. That's the goal. I want you to put this behind you and not have to work so hard towards healing, that you can literally just live your life. You don't have to be so in control all the time and be so fearful about what's going to affect you. And we do that through coming home to your body, understanding your brain and nervous system, and really working with your emotional health. So if you would like to join, find the link below. We are accepting new members into the Mind Body Healing Method, which is just a wonderful, wonderful group community where we all lift each other up and do this work. So remember, healing begins when you stop fighting your body and start listening to it. When you teach your nervous system that it's safe to rest, safe to move, safe to feel again, and once your body feels safe, your brain stops predicting danger. And that's when real healing begins. If this resonates with you, or you are thinking of someone when you're listening to this, please send it to them. My mission is to help everyone or help people that want to be helped. So please send this. And I would love to have you review the podcast. That's how we continue to get this work out there. All right. I will talk to you next week. Keep healing with grace.